Hello, my name is Dr. Reynolds, and in this video we will discuss post-operative instructions for wisdom teeth removal. After wisdom teeth removal surgery, it is normal to have some bleeding, and you will leave the clinic with damp gauze in place over the surgical sites. The gauze can be removed after 45 minutes. Often, the bleeding has stopped by this point. Once the gauze is removed, observe the sites for active bleeding to see if the gauze must be replaced. Although there may be blood on the gauze or in the mouth from surgery, if the sites are not actively bleeding, the gauze does not need to be replaced. If you can see blood flowing from the surgical sites, then please place a new, damp gauze. Placement of the gauze is very important. The gauze is not in place to absorb the blood, but rather acts as a cushion to put pressure on the site. The gauze should be balled up and placed all the way in the back of the mouth and to the cheek side, as this is where the incisions are. You should bite down and leave the gauze in place for another 45 minutes. If heavy bleeding persists, please call our office. For the first 24 hours after surgery, please do not brush or rinse. We want to leave the surgical sites alone as much as possible. After 24 hours, you can resume careful brushing and gentle rinsing with closest mouthwash and room temperature saltwater rinses. But remember not to rinse vigorously. With the rinse in your mouth, instead of swishing, tilt your head back and forth for 30 seconds and then lean over the sink and let the fluid run out. If you are able, please use the closest rinse and saltwater rinse 3 times a day. For the first 72 hours, we want you to do everything you can to protect the blood clots from becoming dislodged. When the blood clot becomes dislodged, it is called a dry socket and can be very painful. To avoid this, please do not use a straw, spit, or rinse forcefully. On day 4 of recovery, the clots have become solid and we can transition to vigorous rinsing. At this time, you can also use a straw and spit. To help mitigate swelling, bleeding, and hematoma formation, please use the cool packs and facial compression band provided to you. Leave the band on full time for the first day. It has pockets for the cool packs which can be slid in and out of the pockets, leaving the compression device in place while you recool them in the freezer. You will likely have a single stitch at each extraction site. These sutures dissolve and fall out on their own. After surgery, please eat or drink when you feel ready. For the first 24 hours, we recommend a cool pureed diet such as a smoothie. Just avoid the straw. On day 2, you can progress to warm, soft foods. After day 5, you can resume a normal diet, but please avoid chewing over the surgical sites until they are fully healed. If you need guidance on what to eat or drink, please reference the backside of the post-operative instruction sheet for a list of approved foods. At the bottom of the sheet, you will also find foods that should be avoided throughout recovery. Please note, any form of nicotine products can be detrimental to the surgical sites and should be avoided for at least 1 week. Starting the day after surgery, we want you to begin opening your mouth wide and moving your jaw side to side several times per day. By doing these jaw joint stretches 3 to 4 times a day, you will avoid the muscle becoming tight, which can cause severe limited opening during recovery. Swelling and pain will increase for the first 3 days after surgery. Many patients report that day 3 tends to be the worst. You may receive 2 prescriptions for postoperative pain management: ibuprofen and hydrocodone combined with acetaminophen or Tylenol. Sometimes that's called Norco. Hydrocodone is a narcotic drug, so please remember, when taking this medication, do not work, drive, or attend school. With these medicines, take with food in your stomach and drink plenty of water. Your first line pain defense should always be ibuprofen and Tylenol. If you have no restrictions, we recommend taking 500 milligrams of Tylenol and 800 milligrams of ibuprofen every 8 hours. Some patients have different dosages depending on their age and weight. Hydrocodone should be used for breakthrough pain only. On your postoperative instructions, you will find the daily recommended limits on each of these drugs, so be sure not to exceed those limits. Additionally, at the bottom of your postoperative instruction sheet, you will see a written time for the next dose of your ibuprofen. Because you were given a similar medication through your IV for the procedure, do not take ibuprofen until this time. Tylenol can be taken right away. Remember that rest is important during the recovery process. We wish you a speedy recovery, and we are always here for you. If you have questions or concerns that this video or the post-operative instruction sheet did not address, please call us at our office at 970-663-6878.